Welcome to the Beyond the Bounds of Your Organization, Systems Influencing and Why It Matters. We'd love for you to put in the chat who you are, your organization, and then also share with us a little bit about you and what would you like to contribute to changing an unhealthy system in the world? You know, what would you work on? So if you can contribute to changing any unhealthy system, what would you work on? Our agenda today is fast-paced, as always. So we'd love to get to know everyone in the chat. Our speakers today are an amazing group of women, social entrepreneurs. All of you know our dear Jeroo Billimoria, who is one of the co-founders of Catalyst 2030, Childline in India, and Aflutan. Then we have Daniela Papi Thornton. She started the Systems-Led Leadership Group. If you know her from Map the System, she did that with the University of Oxford and has been working in the space for a long time. And then, of course, we want to talk about how social entrepreneurs actually impacted and use systems thinking in their work. So way back when Vera was a medical doctor and people would come into the hospital with medical challenges, she realized very quickly that these challenges did not have necessarily to be specific. The medical causes came back to a systemic problem with poverty. So we're going to have the application piece of this call as well. The agenda, like I said, is pretty fast-paced. Please go ahead and put in the chat who you are and your organization so we could get to know everyone that's coming in a little bit later. And I'm going to pass this off to Daniela Papi Thornton, who's going to kick us off for this session. Thanks, Daniela.
Okay, great. Let's do it. So I'm going to speak about systems-led leadership. And what I mean by that, and if any of you have seen me present before, I usually start with these two images, is that oftentimes when we teach or fund or think about social change, we think about my organization is going to scale to the size of a problem. How, you know, it's that idea of like, we're going to win at solving a problem. But as everyone on this call, I'm sure knows, if you're part of Catalyst 2030, is that systems don't change in that way, right? Systems change from lots of different organizations, for-profits, nonprofits, governments, activists, movement builders, etc., contributing in different ways, connecting in different ways. And that's how things change, which is a different set of skills, a different set of ways of thinking about things than how is my organization going to win at solving a problem. So I consider systems-led leadership as taking an action or designing a strategy that is intended to increase the impact of other nodes in the system. And when Debbie was asking for a title for this workshop, I was saying, let's use this idea of system influencing. And I use that term to mean you have a goal of influencing the system, as in you have a goal of working to contribute to a positive change in the system, not to take ownership of it, not to claim that you did it, right? But the goal is that you're trying to influence the system positively in different ways and in different people from different angles with a goal of contributing to positively changing that system. So I view that in order to be systems-led as an organization, it's both about the goal that you have, which is often what we talk about, right? It's like, how are we aiming towards this change in the system? So the goal that you're aiming for and the approach that you take to get there. And I'm going to give you some examples of that, right? So I think a systems-led goal is when you're using your systems understanding. You're never going to understand the whole system, but you're working to understand it better. And that helps you set a goal for what you're trying to do, right? And that's either focused on a root cause of the problem, or it's focused on an impact gap, something that's missing in the solutions landscape. And I'm going to give you two examples of this, and a lot of examples from Dara that we're going to hear. But first, I'll just talk about Upon in Bangladesh. They have kiosks in garment factories, serving the mostly women who work in the garment factories. And when you shop at these kiosks, you earn credit towards microinsurance, so really low cost insurance. And their goal, as stated, is to offer, at the time, they're selling low cost insurance to the poor, economically. That's what they were doing. So you can imagine if they're just trying to do that, the goal is, okay, we're in one garment factory, 10, 50. They went through the Ashoka Globalizer program and looked at their goal, like what are we trying to achieve, and looked at the different levels of the problem. And they came up with a new goal. And that new goal was, we are trying to create a market for low cost insurance for the poor. So you can see the difference in that goal. If you're just trying to sell low cost insurance for the poor, you need people that can sell it. If you're trying to create a market for low cost insurance for the poor, which is to create a different, a different piece of that system, you're trying to create copycats. You're trying to influence other big players to get into that space. You're trying to educate people about this space, right? So that's an example of a different goal, an impact gap. That was the gap that existed. And we'll just look quickly at Dara. And obviously Vera's going to give us a lot more information. But just like Debbie just said, initially it was about disease. People are repeatedly having to come into the hospital. But what Vera noticed was there's joblessness, lack of food. People don't have legal papers and their legal citizenship. They don't know their rights. All these things that were saying that people who are living in economic poverty were more likely to be coming into the hospitals more often. So if we just focus on this tip of the iceberg, instead of these root causes, we're gonna we're gonna end up with people still being in the hospital, right? So you need a system-led goal. That part's easy. But it's also the approach, right? And I'm gonna look at a few, systems-led approach is using system practices to drive your strategy and how you do what you do. And this is not an inclusive list, but this is a list of the things that I noticed specifically with regards to Vera's work and with Dara Institute. And so I call this wide listening. And what I mean by wide listening is, I think the quote was that Vera said, children and family are a unit, right? So it's not normal that you think a kid comes in and they've got a sinus infection and the solution is that you're saying, oh, we're gonna have someone come help you fix your roof and we're gonna help your parents get citizenship papers, right? But actually it's this wide listening to a problem, wide approach to looking at a systemic issue, because if you're just looking at the child's symptoms, rather than the wider context, you're missing the things that could influence change. And therefore, it's a nonlinear approach. It's listening informed, right? Dara doesn't go in and say, first we help with this. First we help with the house. And then we help with the citizenship. And then we help with this. And we just do this first. And then, no, it's about using that listening to design an approach that's right for this particular situation, right? And that you can imagine how that works out in your own organizations, your own sector. Multi-perspective team, including lived experience. I'm sure everyone on this call is well informed about the value of lived experience, value of lived expertise. And if it's something you're interested in more, you should definitely read the work of Baljit Sandhu in that area. But multi-perspective team, right? Their initial approach was to disease, but they have architects on their team at Dara Institute. They have therapists. They have people that are helping with human rights and citizenship work. And they have also perspective on that issue of poverty from many lenses. Okay, sharing beyond the bounds of your organization. Once again, looking at that system influencing piece. There are, I think, Baltimore and Europe, people have copied this work of Dara Institute and learned from them, right? So how is your organization, when you think about your own work, how can you share beyond the bounds of your organization to influence change? And then connecting. In this particular case, Dara, when Vera tells us more about Dara and when she spoke to us about it, she talks about, we're not an expert in education. We're not an expert in all these pieces, but she used the term spine. They're a spine organization that is connecting out because it's a recognition that poverty cannot be alleviated by one organization with one approach, right? So they're a spine organization who connects out. And finally, I think this is a piece that definitely needs to be built into all systems-led approaches, which is the ongoing, built-in self-reflection and learning, right? Ongoing, built-in self-reflection and learning. How is your organization ongoing and built into your practices and your weekly and daily and ongoing practices of self-reflection and learning for the individuals on your team? And then that takes it wider than that, right? So we can understand that the goal, once you know what your goal is, right? Once a pawn switch their goal, it's going to influence your approach. We're no longer just trying to sell this low-cost insurance in Bangladesh. We're now trying to influence change in the system. But you can see how the approach also shifts the goal, right? And in Dara Institute case, they started by looking at people that were in the hospital who were having disease, and then started working on the causes of poverty to change that. And now it's no longer, it needs to start there. They realize, why should we wait till this person's sick? We can work with anyone to prevent this. So we'll hear more about that. This is a tool for thinking, how do I even start thinking about it? This is the Impact Gaps Canvas. This is a really basic tool that I designed that helps you start to think about these questions, the problem, landscape of current solutions, and the gaps. And I'm looking to kind of write down and support more of the things that we just talked about with cases and examples. So if any of you have things like that or want to help with that, please reach out. But we're going to get into these questions at the end after we hear from Vera and from Jeroo. But I want you to just think about this framing of how is your organization systems led? Based on these examples of goals and approaches, what's missing or might need to be changed? And we'll talk about that at the end. Okay, thank you.
Great. And just to give us a second, because I know we love to go super fast and we love everyone when they're on camera. And does anyone we have a minute for a question for Daniela about kind of this framing and starting point for systems change before we go on to Vera? You guys are easy. All right. So Vera, off to you.
Well, thank you very much for this opportunity to share Dara Institute and how we spread and how we inspire people. So I'm a physician and I worked during 20 years in a public hospital in Rio de Janeiro called Hospital da Lagoa. I worked the 10 first years with adults, but then I went to the pediatric service to work with children. When I started working with children at the Hospital da Lagoa, I realized there was a vicious cycle: poverty, hospitalization, rehospitalization, and death. And that was terrible because, for example, I understood, as Daniela said, the disease is just the tip of the iceberg. Behind the pneumonia, for example, was a jobless father, a mother with depression, the housing is falling apart, there is no food. So the disease is just the excuse for poverty to appear. Vicious cycle, like Debbie to show that I understood, not at that time there was social determinants of health, but I understood that I have to go beyond the hospital walls. But I create a group, a triage group inside the hospital to send the most vulnerable patient to our headquarters. So next, please, Debbie. So this vicious cycle that I showed, that I told you, there is a mother with a child, then they went to the hospital, they were discharged, and 3 months later, the same child came back again with another kind of infectious disease because the real cause was poverty. I understood that I had to go maybe beyond the hospital walls to create something new that I have no idea. But I understood that we were not, although the physician, the social worker in the hospital, they were very good. It's something new that I have to address. We have to address. So I went to a huge park in Rio de Janeiro. I walked distant from the hospital, but in fact, it was a stable where the horses used to be. We have no money at all. So I start ruffling things of our elder, I and other volunteers. I was a volunteer for 12 years. I treat the child in the morning and I send them to this table in Rio de Janeiro. And we start to listen very carefully to the family we were trying to treat in a more, how can I say, a more wide way. So as poverty is a multi-dimensional problem, since the very beginning, in the stable phase, we understood that we have to work in a multidisciplinary way if we really want to fight poverty, not make a maquillage in poverty. So next, please, Debbie. So we started in a very simple way, as I said. We raffle a bed sheet and we raffle things on my house, and the German people came to help us. But that I don't want to go deeply in those details. But then Ashoka McKinsey gave us more than 5,000 hours pro bono to help us to establish, the social methodology. Avina, Schwab, White Martin, and finally Skoll. So next, please. Since the beginning, it was very strange because we didn't have a very well-established methodology, but people knew we are creating something totally new approach to disease and to poverty. So people from different hospitals, 23 different hospitals in Brazil from 6 states, they came to visit us, and we established a network of sister institutions called Renascer, Reagir, Renovar, linked to 23 public hospitals in Brazil. Next, please. And in the year 2009, we became public policy in Belo Horizonte, one of the largest cities in Brazil, because Avina, one big nonprofit, they understood that what we are doing was very important, and they want the government to make connection with us. So we became, Marcelo Mourão, the only man in the picture, he said that we created something very important, and he aims to promote this methodology all over Brazil. I can explain what happened. What is our social methodology? To go right to the point. We work in 5 areas in a very integrated form. I think what we did that is totally different from other organizations. We work in health, body, governance itself, education. We understand health in 5 areas: education, citizenship, housing, and income generation. So we understood that health, we have to change the paradigm of health, because health, hospital center, body center doesn't work very well. So this next one, Debbie, you can go. So what we create after many, many years, listen to the people we serve, not top down, but listen to the people we serve, process, the family action plan. There's a triage. In nowadays, 7 institutions, they can send people to us, and we listen very carefully for each family, because one family is totally different from another family. So we establish goals in those 5 areas, and monthly with the family, the physician, the pedagogue, the nutritionist, the psychologist, the engineer, they see if the family achieved those goals that the family she co-created with us. And finally, after 2 years, we conclude the program. Next, please. This is a real room at Dara headquarters in our days, and there's different types of areas of human. So, for example, there's physician, as I told you, engineer, social workers, psychologists, and we have a very robust IT system. So we track the family during those 2 years. Next, please. So just to give an example, there is the area of education. They help the family, the whole family, to send the children to the school, the health area, the physician is there, the lawyer is there explaining the rights that the family they have, but they don't know they have the rights. The lawyer explains how to navigate. And then I will give you a life example. Just be clear to you what we do. That is Rita and her son, Juliano. Juliana went to the hospital many times, but we visited the family and look where she lived. That was her house. Her house was falling apart. So we reformed her house, Rita's house. Is the next one, Debbie? We reformed the Rita's house. That's the new, you can see the body language in a best house, sometimes a small reform and sometimes a huge reform. Rita and Juliano, they appear in the new house. And when Rita was discharged from Dara, you can see the body language when she arrived. And finally, after 2 years, I cannot explain, just look to the body language. It's not simple, it's a lot of work, but look to the body language. Next, please. Georgetown University made a research, the long-term impact of Dara. So what was proven by Georgetown in the year 2013? In terms of days of rehospitalization, it falls down 86%. In terms of income generation, 3 to 5 years later, when the family is discharged from Dara, there is the income almost double. Next, please. Sorry, because something is written in Portuguese. So before that, only 28% have their own house. After 3 to 5 years later, from Dara, 51% have their own house. Small house, but own house. Next, please. And in terms of, sorry, the shot before, Debbie.
Okay.
In terms of well-being, sorry. In terms of well-being, the next one. In terms of well-being, 56% of the family thought that their well-being was terrible, very bad. The family was very unbalanced in terms of well-being. 3 to 5 years later, that numbers was totally opposed. It was totally different. 51% of the family, they saw the well-being of the family very good, good, and very good. Next, please. Muhammad Yunus said Dara Institute has created a very powerful methodology to include the poorest among the poor. Next, please. So this was the stamp, the recognition. We see more than 50 national and international recognition, but more than that, is Dara. I gave more than 50 lectures in 16 countries. And so people started to understand the Family Action Plan, the DNA of the Family Action Plan, and they replied this DNA in different ways in 4 continents. So Dara directly transformed the life of more than 75,000 people. But indirectly, through other social entrepreneurs that learn the DNA of, and they apply in other ways, they make a movement. So Dara now, DNA of Dara now is in 4 continents. And we have those recognition of Ashoka, NGO advisor, the best NGO of Latin America for 9 years, and one of the 21 best in the world, all kinds of recognitions. Thank you all.
And we do want to go ahead and give some time for some questions to Vera. I'm sure all of you are blown away about this model and how it truly is changing the system for these folks that are involved. So we also have some of our team members here as well. So do we have time for 2 questions?
May I ask Debbie?
Sure.
Okay. My question is, that's a quite a proven system, and it is very obvious that it works so well. What is the main obstacle to scale it even further? Is my question.
Debbie, please, can you repeat the question, the same question with other words, because I couldn't follow him.
Sure. Some of the ways that you've been able to scale it further. How did you do that?
What are the problems to scale it
Mhm.
in Brazil and outside? The main problem to scale, to tell the truth, that's a wonderful question. Is, you know, in the beginning, we made, like, as I told, we influenced 23 institutions all over Brazil. It was good for like 5 years, but then visiting those sister institutions, I understood what Jeroo told me one day: we cannot lose the DNA of the institution. So visiting them, I understood some institutions, it was totally different. It was not the DNA of Dara. So we start to close those institutions because we didn't want to lose our DNA, because we knew it works. This is it was one first challenge to scale. Regarding public policy, the other challenge to scale was, it was very successful in Belo Horizonte, you know, be a public policy. Our DNA be a public policy. And I'm sure, because Adriane Mena Barreto, our CEO, she's in contact with the federal government at the moment in Brazil.
Mhm.
At that moment, when it became public policy, I thought that this experience will be spread all over Brazil. But the mayor changed, and they took money out from this project. So they cannot stop the methodology, but they can diminish the financial resource. So this is a problem. But thanks God, now we are talking not with Bolsonaro, my God, our president, but we are talking with the technical people in Brasilia, our capital, you know, spread public policy as far as we can.
Great. Sharma, you had a question.
Yes, thank you, Debbie. I actually had 2 questions, but I'm going to try and say, amazing, Vera, this is fantastic. The 2 questions that I have, first one, do you have a way to sort of establish a baseline for the family? Because I clearly see you're doing data, and then for every family in 2 or 3 years, say this is how far they've moved. If you are using some kind of tool or methodology, that would be fantastic. And the second question that I had was, is there again a tool or a specific way that you're doing these family action plans? I asked both of these because we're doing something very similar in India. And I would love to be able to build off of what you are already doing in Brazil. Thank you so much, and amazing work.
Shana, thank you for your question. Yes, we have, as I due to Adriane Mena Barreto, I have, because she's wonderful in IT system. We have and McKinsey and so on in the past, we have a very robust IT system. So for example, you are a mother, so you are finishing your process, and sometimes you complain you want to be more time at Dara Institute, but I have a lot of reports that I can take in 1 minute from the computer, and I can show Shana. Shana, look how you arrived here and how you are now. Look the difference. We need to you know, make other families, other poor families to come into Dara Institute to have a lot of report. But also we are finishing our app. We have an app now. We don't have finished it already, but we will finish in the middle of this year, so the family can look to the improvement in all those 5 areas, and they can, you know, realize for themselves the path they are achieving, what they are achieving. I think the tool, the app, is very important because we can, you know, go to other parts of Brazil with the app, and the whole family can visualize the improvement. But I have to emphasize, the app is just the tool. What is very important, the app is the tool, But what's very important is the connection between woman being and, to map the resource of the area. If you map, for example, in India, what are the best job training? What are the best hospitals? What are the best legal department to refer the families? And if you make a very deep, connection with each member of the family, you change people's lives.
Mm-hmm. And I will add this to Vera, the computer, the technology that they have, the app that they have that everybody goes through, and you're basically checking off, I did this training, I went to this nutrition program, I did this step. So the mothers and the families can keep track of all that they've done. And Adriana has done a great job with that, as Vera said. So Leha, you have a question as well. Go ahead.
Yeah, thank you, Debbie. Thank you, Vera, Daniela. Okay, so Vera, as I wrote earlier in the chat, our College of Medicine was established primarily to serve the underserved for healthcare of the needy in the Houston area. And they started the program with household-centered care. That's what it's called. Mm-hmm. Looking at the totality of the family, not just as the sinus infection, as Daniela was saying, of a kid. How do we, where can we get access to your program where I can take my people and say, this is what Vera is doing, this is what the Institute, and they can learn, and then how do we reach out to you? Is there a comprehensive, place where we can go and learn about it and then reach out to you?
Debbie, I don't know sorry, thank you for your question. Sure. I don't know exactly if I understood your question, but I will try to answer you. If I am in the wrong way, please correct myself. My English is not very good. As you can see, you can hear. So just let me tell you, for example, Baltimore, we transfer our methodology to Baltimore. There is a nurse, Yolanda Ogbulu, she's a PhD. She understood through Maryland University that what healthcare is doing in Baltimore is not enough. So we became like consultants, like a McKinsey for her, So she came to visit us twice in Brazil, and Adriane, myself, and the whole team of expansion, Flavia, and so on. We helped them to understand the step-by-step what she can apply in another culture, like Baltimore, United States, is another culture. You have to make you have to adjust something because it's not Brazil, it's the United States. Right. And we also transfer to Mozambique. There was physician. Girls Move. There's a program called Girls Move in Mozambique, in Africa. Mm-hmm. So they learn about us, and they ask us to provide them some guidance. So we became consultants. I don't know how to say that in English, consultores. We became consultants, them to Girls Move movement, and we have the triage part of the methodology, how we follow up the family, how we finish, what are the main criteria to discharge families from Dara Institute. So there are many ways to explain another organization how to implement. And of course, we have to learn different cultures to apply that methodology.
Okay.
That's wonderful. And
thank you.
And
thank you.
I think the visits of the hospitals to Brazil to see it firsthand, it makes their minds click of all these opportunities. So we're going to continue. We'll have time for questions a little bit later on, but I did want Jeroo to talk a little bit about her knowledge of systems change and how Catalyst is looking at systems from a different perspective.
Thank you, Vera.
Thank you all. I'll be very brief. I think Daniela and Vera have been amazing. I think the way Catalyst is looking at it, and I think we have a lot of work which is being done, is essentially how can we accelerate systems change by collaborating further. So what would it be? So basically, like Daniela said, Catalyst is looking at what would be the key impact that we want to achieve, and that would be the first thing. So I'm building on Vera's case study. Vera wants to have an integrated approach to healthcare, starting with poverty alleviation and everything. That's the concept which Vera has. Now she can scale it in Brazil, but there are several other people, example Shama, who's working in India, who has tons of experience. And I know there are people working across the board in different countries. So then what do? We would put people who are doing similar type of work together and then see if they can, because there may be things which Shama has which are missing in Vera's concept, which Vera has, which Shama can learn from. And together we evolve a concept which is very similar and very specific to individual cultures and countries, but at the same time, we are then able to take it and people can take that concept and scale it in their own countries. And they have a sounding board. So what have we done? We've kept every individual idea, but been able to provide a platform where the concept can be scaled and doing it through basic principles of trying to learn what are the commonalities and differences in the concept, co-creating a concept which will work, jointly finding out who are the stakeholders who could be jointly and collectively leveraged. So leveraging those stakeholders and then making the scale happen. Because then we are able to do it. Because if Vera now were to take her idea and go to WHO, she'll probably have to done 50 hoops. But if you have Vera, Shama, and 5 other people going together to WHO saying, hey guys, we've tested this across different geographies. It's very robust. This is the concept we want. We are able to open the door faster because we have one of the key principles that I think of Catalyst, which is the power of the collective. And together we can go stronger to change the systems that we want. So what are we doing? We're leveraging collective power, collective knowledge, collective action to be able to accelerate the change. And that's what we want to do. So for me, as I listen, what I would love is not just Vera and Shama, but anyone else in this group who's working on health, like I see Arjun and I don't know who else, we are able to get them together, look at the commonalities, build something, and boom, take it. And that's what I would say is a systems collaboration which we take place. And that whole concept, then we are able to take to scale, not just in the country or the region, but globally in a big way. And that is what we are looking at, which is catalytic change, which is accelerated change, which makes the change grow at a faster pace, leveraging the power of the collective. I was given 5 minutes, Debbie. I'm in time, I hope.
Oh yes, you're always fast, and I will have to show you her definition as she's been working on this with back when Jeroo was with Apluton. But I think the catalytic change collaborations that we, getting those with those stakeholders together on a specific complex problem, which we're going to ask you to get through this now, leveraging the power of the collective, putting in those change conditions so that we can change the social, economic, environmental issues that have been in place for a long time. So I'm going to leave this to Daniela to get you started on the breakout rooms.
Thanks, Debbie. Okay, so we're going to do just a few minutes of self-reflecting on our own organizations and our own work. And then we're going to send you out into breakout rooms to have a conversation. And in the initial reflection for a few minutes, I just want you to think back to this idea that being systems-led is both about the goal that you have. Is that goal addressing a root cause? Is that goal addressing an impact gap? Is the goal's intention to increase the impact of other nodes in the system, right? Because we exist, other people's work is improved, right? And so that's a question on self-reflecting about the goal. Is our goal systems-led? What would make it more so? And then the other piece is reflecting on the approaches. So wide listening. How are we doing our listening? Nonlinear approaches. Is our actions listening informed? Multi-perspective, including lived experience, sharing beyond the bounds of our organizations. Are we sharing? How could we be doing more? Are we connecting? How could we be doing more? And then the final one, ongoing and built-in self-reflection and learning. So we'll just put a quick timer on, give everyone a minute or two to reflect on their own work, and then we will send you out to discuss.
So go ahead, then Daniela, to set us up for our discussions.
Thank you. So how many are we putting in a group? What do
4.
Okay, great. So we're gonna go out and you're gonna have 7 minutes, which really just gives you maybe a minute each to share something that you've just reflected on for the last minute, and then maybe have a conversation. So it's your opportunity to think about, are our goals and approaches and are aligned with systems-led leadership, and maybe it's you have questions for your other 4 people, maybe you want to reflect, and then you can bring that back to us in the form of if you have a collective question or a collective thought that you want to share back to the group. We'll see you guys in 7 minutes.
All right, we'll let you go. Daniela will wrap us up. Audio.
Sorry, first time on Zoom.
We could hear you, Debbie.
Did anybody in their group have a shared question or a shared, piece of reflection, something really cogent and quick that you could share with us or you want to bring back to the group? Shama.
So I think some of us health people were with Vera, and what we agreed that we need to do going forward is that we would come together as collaborators on systems change or systems innovators in primary healthcare, but because we have so many common elements, actually describe it and actually then take it. Jeroo, we want your help to take it to the world to say, come in and amongst us, we have all the evidence. All we just need is the backing so that we can actually do at scale what we know is possible to work at scale, right? And work with everybody. So I think we agreed that is something that we needed to do.
Okay, great. You all need to kick it off at Catalyzing Change Week, and let's see, we try to get someone from WHO there, with y'all and whoever are the other stakeholders y'all want, and let's make it happen. Simple.
Mhm.
What do you say, Daniela?
I was just about to say, so what you're saying is that our breakout room is positively changing the world already. Great, fabulous. Great. So Debbie, I just want to clarify that. We have 15 minutes, so we have time to
Mhm.
to take
Mhm. A little bit more
to get
time.
into conversation rather than rushing in the next 90 seconds.
Mhm.
Thank you for that. And that's beautiful example of what a group like Catalyst 2030 can do, right? So when I think about different roles in the sector, one is the role of bringing people together, right? Because sometimes just that and just that type of breakout room, expertly coordinated by Debbie, can create those connections. Anyone else come out with questions, thoughts, conversation they want to bring to the group?
I know room 3 had a good or room 2 had a really good discussion too. Sylvia, Catherine. Mhm.
No doubt, Catherine had a good.
Exactly.
Well, hi everyone. I mean, yeah, Adrian, did you want to offer something from our group?
Your English is much
Sylvia?
better. Your English is much better than mine. You can go. Please go. Please talk about group 2.
Well, it passed very, very quickly, and there was still so much more to unpack. But I think one of the points of commonalities, and sort of Sylvia, please jump in if I'm, sort of mischaracterizing, but is just the sort of the tensions between progressing on the strategy and then allowing for emergence, right? And sort of those opportunities that come and through the deep listening and everything it is that you're describing, Daniela. And how is it that you think about it from an organizational capacity point of view, sort of the resourcing and the bandwidth, to just be emergent in those ways, even while you're pursuing, kind of the strategy. So that was a little bit, I think, one point among many in our conversation.
Adrian, you want to add anything, or anyone else from that group?
We just to add, actually, definitely complementing, very, very important point, approaching this attention. So Catherine shared, this particular very important point. And we were also, sharing, the importance of working together, but also versus problem solving, isn't it? So it's not just by collaboration, but it's a collaboration, but what is around, what is at the center of the equation. So I think, like we were saying in today here, Vera's work, when we have a problem at the center is where we start to build up upon that. So that's a very important focus.
I missed the one thing. So not just collaboration, but what in the center? I missed the word.
Problem
Okay.
center.
So having a shared goal, a shared
we were sharing, like in Catalyst in Portugal and Spain, we are, designing, a systems debates, bringing at the table the representation of the system, so different stakeholders to debate, and this is important. But we are very aware that this is an important first stage to align this, as you were saying, the problem landscape, isn't it? But we need to have the problem at the center in order to start to build up this collaboration. So that's why it's hard to move on the path of collaboration, because it's not just collaboration for the sake of collaboration, it's collaboration for the sake of problem solving.
Yes, beautiful. Thank you, Sylvia. When I worked at the Skoll Center in Oxford, the Skoll Foundation in the US wanted us as an academic institution to bring different groups of their funders together to work on, what research could we do, could we have academics at Oxford solve. But one of the problems was it was just like, these people all care about water, but there wasn't a common, we hadn't solidified this, like the common goal, right? There was a lot of goals that happened to be in the same issue area, but there wasn't really this common problem that they could all point to, right? And I think that oftentimes when people think about systems change work, I often get the question of like, how do I get everybody to work with me, right? And it's like, you don't need to get everybody in your sector to work with you, right? It's not about a sector, right? It's about anyone else who has the same goal with you. If they legitimately share that goal, great, then they're all already pointing in the same direction as you. You know, just because you care about healthcare, care about water, whatever, it doesn't mean you actually have the same goal, right? So I think that's a really, really good point. And that actually two organizations coming together is that have the same goal and can work together, learn from each other, is better than 10 who are in the same sector trying to find something, because it's just a lot of talking and you know, not a lot of improvement. Anything else? Other questions, thoughts, something you want to bring to the group?
Actually, if I may, again, sorry to capture the, sorry, I was just looking for the hand to raise the hand, but I wasn't able to find. So I'm waiting for you to nominate the time.
Sorry, go ahead.
Go ahead.
Yeah. So very quickly. So I think that's very important. But one very important thing as well that we need to keep in mind is, you know, the process, how we build these strategies, isn't it? And I think, you know, we have a lot of discussions around what we need to do. I think all these are pieces on the same puzzle. But what we need to do actually to be more aware about what is the puzzle, what is the process. Because as you just say, what you just say is super important, and that's absolutely true. But we could argue, you know, that actually having a first discussion at the beginning, you know, about discussing what, you know, what system change is about, or later on, you know, like not just the people who's aligned to the goal, but, you know, also the stakeholders that they might not be aligned to the goal, they might also be important. These are all, you know, important parts of the equation, but they're actually different stages of the same process. And I think what you said before, you know, the importance of kind of having these similarities, Vera was saying, you know, and Jeroo, you know, what are the similarities in between processes is what is going to give us, you know, a common vision and a common language of what is the, you know, the steps we need to keep on moving further. So we can all have a tool where we can have a kind of diagnosis to say, where are you in this equation? Where are you in this process? So you are there, you are aligning with people who are sharing your goal, great. So probably you have built up before, you know, some kind of language together, some kind of understanding of the problem. That's great. So what's coming next? Because we have that picture, we have that puzzle put together, isn't it? Other people might argue, you know, okay, no, it's more about, you know, bringing the stakeholders that are not, you know, sharing our goals because actually it's going to make the difference and scale up. Yes, so because you are actually further on in the process. So it's about having a tool, a vision, an imaginary, you know, a kind of picture that offer us the opportunity to really articulate these debates more in a more structured way, so we can move on and you know, start to discuss, so what? This is what is my contribution. And I share in the chat actually that I developed, you know, a kind of way, a model, conceptual model, and a tool to actually build up this common picture of based on commonalities. So I'm happy to share it with you at some time and see if it's useful for us. So just want to say that. Thank you.
Oh yeah, I've already got Sylvia to do this model in Catalyzing Change Week. She just has to get this, you know, put it together. But I think this is the idea that we have this great session and then we have this action part next. And what Jeroo wrote about the collabs, maybe there's a healthcare collab. And so we'll reach out to you, Arun and Sharma and Vera about that as well.
Great. And I think I wasn't trying to say that you leave people out, but I think that there's often, or what I have seen sometimes is people find that there's sometimes a barrier towards initial action until they can get everyone around. And when you can start where you're at, Catalyst 2030 doesn't need everyone who comes to every webinar, every group to have the exact same vision. Catalyst has a vision to, you know, and there's a sharing of learning together, right? And so therefore the people that come into that vision don't have to say that is my 100% goal, right? But yes, so I 100% agree with you, Sylvia. If you put something out there with the 1, 2, 10, 500 that do share a belief in something, and you like open your arms wider, you'll slowly get more and more who want to be part of it too. Yeah,
wonderful.
Absolutely.
Building on what Daniela and Sylvia I think what's lovely is it doesn't take more than 2 or 3 people to kickstart something, you know. And then we start small and then we can move on and grow on, So I think that would be lovely. And I always say, if it's okay, we have something concrete and we can actually being very practical. And luckily Deepa joined. So I'm going to put it on her very happily is, Shama, Vera, Arjun, what would be great is you all come together, the commonalities, and what would be nice is to identify who are the 2 or 3 stakeholders you all would really need to take your idea to the next level. I don't know. I'm not in healthcare. So I don't know whether it's WHO. I don't know whether it's OECD. I don't know whether it's whatever. Whoever, I don't know. Okay. And then what we do is, because we're doing this collectively, you invite those people in, the key stakeholders, to talk with you all. And in addition, then we can ask other members who are in healthcare, and you all can go through and say, these 7 will help us, or 10. Kickstart something, and maybe next year you will have something which is going. If not, at least you've learned about each other's, like you did today, from across the world, and in your existing programs, you will have new ideas from each other, So I think I'm just saying concretely, that would be fantastic. I was just thinking, I know, Deepa, you were talking that we could probably get someone from WHO in Catalyzing Change Week. Maybe at a keynote session it's different, but at a more concrete session, and see, link it and see. I'm just thinking totally out of the box, but I do believe, and maybe we are learning from y'all. As I'm listening, and I put it as, maybe we restart our collaboration corner, and Daniela, maybe you start helping with anchoring some of those, where we start catalyzing collaborations more, and see where they go. So it's once every 2 or 3 weeks. It's nothing. We can take an issue and we just say, okay, this is what it is. This is how we're structuring. And then we just take it to any ideas leading, It will be something really interesting. We can kick off with everybody.
Yeah, I think specific, very concrete idea based rather than broad thematic always tends to work much more effectively, because we tried it with thematic areas
and
it doesn't work. But the more concrete of, we want to bring together people around X, as tight as it can be, is, and the innovation and the creativity comes from the sharing of the solutions and the work that people are doing around that specific theme, rather than you talk about climate change, we could be here for days.
So true.
Yeah.
And Deepa, I think what we were trying with Working Group 3 and collaborations last year with the hosted huddles, which I know didn't go too far, but that was it, right? To get different members to share their specific things that they're sort of doing or working on, or the way they're seeing systems change, and then see who else aligns and wants to work with it and sort of launch off.
Yeah, I think that the reason why they didn't was because of they were too broad.
Well, we did only one huddle. Right.
Yeah.
And I lost track of that after that.
Yeah.
But I think what Daniela brought today was the structure and how we are thinking. So maybe we need to explore how to do that, So Daniela, maybe you may get roped in.
Daniela, I will email you.
Yeah, and I have notes from the first one as well, Daniela. I'm happy to share what we did as a just background of what worked and what could have gone better. But I do think it's we need more of these conversations as collaboration corner to get more things actioned, I think.
Yeah. And I think you can, like Deepa, I guess, was the one who just said, you have to have a strong issue. It can be an issue like, how do you scale, a specific type of healthcare action, right? But it can also be, how do we create internal learning processes in our organization, right? It can be about a specific issue within an organization.
Yeah.
Okay. Over to you, Debbie.
Okay, so just as a quick wrap up, next steps that Daniela and team wanted to remind you of is, how do we take these actions? How do we become more systems led? How do we continue to improve our understanding of systems? And there are some wonderful workshops that are coming up for Catalyzing Change Week that we will have happening as well. And then the third one is how can you help, your own organization and your own communities in your own region to see more people becoming these catalysts for systems change. So that's the term that Jeroo has, the catalyst of systems change. Two things, and then we could do a couple more questions, Sylvia, if you want. Just mark your calendar. There's a fundraising masterclass, demystifying the complexities of the funder landscape, that's coming up on March 24th. And the systems work of social change, if you were not able to do that workshop series, I can put it in the chat, and you can have the information about the accessing the systems work of social change 3-part workshop series, cases and materials, if you are interested in that. So thank you again once for everyone for joining in, being so active in the discussion. And Sylvia, do you have a last question or thing to add with a hand up?
Yes, thank you. Thank you, Debbie. Just a comment, a suggestion. I think that it's very important, that in opportunities like this, we kind of gather some resources of people working or interested to work around building up these kind of tools that will help us with different processes. For example, if we can have with this idea of building some kind of map or tool, help us to really see how these processes are built, that, based on the experiences from, the health sector, as we just see in this lab, we can throw some materials that we can, test and, improve for other topics as well. So inviting a couple of people, not many, but a couple of people who are interested around, building this kind of, in particular, this tool, or for example, we were discussing in our group about the theory chains. We are working as well in creating a model for the theory of system change, integrating the elements that are important to work in system change approaches when you build your theory chains. Again, it's an opportunity to really, come up with something that we can keep on testing. That was my suggestion.
Wonderful. Thanks again. I put in the chat the link for the fundraising course. Sorry about that link. Have a wonderful afternoon, evening, morning for those. And we appreciate all of you being here today.
Thank you.
Carol.
Thank you so much.
Vera.